Now our online courses are available. We conduct them twice a month. It is the 5th of the month and the 20th. The duration of the course is 2 weeks. After that, we conduct the test to examine your knowledge. We have the question about the inhalation of ozonized water and oil, and Claudia Nikolaevna will join us and answer in more details. There was a question about the experience in treating the consequences of COVID and pneumonia results. Yes, we have already this experience. It was studied in Spain, Germany, and USA, as well as in Russia. But as for Russian medicine, the ozone has been recognized as a legal medical services the 18th of April, and it was registered as a legal area of medicine. As for the treatment of COVID, there were just few examples because it was carried out in a complex way with other methods. But as for the consequences of COVID, we had a lot of experience. We are publishing these articles in our Instagram, Ozone Therapy Point. Also, we could publish it in our common group of ozone therapists. We have many articles in English, but also there are some links of Russian scientists who have made the studies. First, it is the application of ozonized physiological saline, as well as for ozonized oil. As for the inhalation, it was not mentioned in our manuals for the application of ozone therapy, but as I have made the fundamental studies of ozone application, it was mentioned by Oleg Maslenikov for the treatment of bronchial asthma and the pathology of lungs and the chronic obstructive disease of lungs. So I would like to tell about the properties of ozonized oil and water. Oleg Maslenikov, together with his colleagues, they have mentioned the properties of ozone therapy in this way for the purpose to remove the clinical effect of the disease, to remove the spasm of the bronchi, and also there was an anti-inflammatory effect. So the purpose is to kill the infection, and we cannot use the sanation in this way because the concentration of ozone for killing the infection must be very high, and we couldn't apply the high concentration in our external application because it will destroy the sulfates of lungs, and the lipid layer will be destroyed as well. As for the ozonides that we could use in this way. So the difference between the application of ozone in external way and internal, because when we use it in mouthwash, it is one thing, and when we use it for intestine area, it is the other thing, and you must use it. You must be aware of a high concentration of ozone and be careful using ozone in internal methods. As for the ozonized water, could we use the water or physiological saline? In this case, we speak about the ozone that is destroying very rapidly, and we can see that free radicals are appearing. I mean the free radicals of oxygen. and in this way couldn't do harm to the organs. We can't say it without conducting the tests and experiments on animals. In order to use it as for inhalation for the COVID patients and for the rehabilitation of after COVID, you have to be very careful with these patients because they have some complications and they have the immune system defects. The hemostasis may be provided as well, and we must remember about the hypocoagulation effect of ozone. As for the effect of ozone, we must study this effect on the blood and on the organs. As for the physiological saline, in my opinion, the reasonable way of the application is the ozonized physiological saline, and maybe we could use the minor autohemotherapy. If the rectal insufflations are possible, we also could include it in our treatment. As for the experiments with animals that we were conducted, and we have put the animal in such conditions where they inhalated the humid ozone. And I'd like to pay your attention that the lungs of animals suffered. And that's why I would like to recommend to use very low concentration of ozone in this case. The question is about the low dosage. What is low? And Claudia Nikolaevna said that there are no exact figures about the dosage because there were no clinical studies conducted yet. And she could recommend the lowest dose of the ozone therapy as depending on the age and pathology, and it could be from 200 up to 300 or 400 micrograms per liter. But she could recommend the ozonized physiological saline and minor autohemotherapy because this technique is rather easy, and with the inhalation it is not widely used and not studied for 100%. As for the rehabilitation after the heart attack, could you recommend to use ozone therapy? Yes, the ozone could be used in acute period of the disease, and you could treat it in the early period of the heart attack. If we speak about the methods of ozone application, what is the method? There is a method of the common metabolic effect, as for the local treatment as well. If we speak about the wide application of ozone therapy, it is the intravenous drip injection of ozone. Then we see the major autohemotherapy and the rectal insufflations and minor autohemotherapy as well. The question is about the dosage. What is the therapeutic dosage of application? And the answer is the professors Claudia Nikolaevna, Oleg Viktorovich, and other colleagues have conducted the studies, and the dosage are described in detail in the manuals that they have made. The question is about the efficiency in atherosclerosis disease. And the answer is the pathogenesis of atherosclerosis uh, uh, have been studied, and the ozone therapy is one of the most powerful methods in this way, because the liver's works and the cholesterol goes to the vessels with the lipoproteins. Then the walls of the vessels are damaged. As a result, there is a reaction of atherosclerosis plaque. We have to revise the issue of atherosclerosis, because in the 18th century, when they studied the gallstone disease, it was one thing, and in 100 years, the cholesterol was recognized as a matter that doesn't contain fats. It was recognized as a solid alcohol. That's why there were the substitution of concepts, because in Russia it stayed like cholesterol, and in other countries it was a cholesterol. So the scientists uh, made made a new discovery that the cholesterol doesn't contain fats. About the cholesterol, I would like to mention that it is the molecule of life, and it is connected with the formation of new cells. It is the basic structure if we compare it with the construction field. For example, the membranes of the cells are being formed, including the lipids and other elements. Uh, Also, there are some receptors that help the cells to communicate between each other. And as a result, we see the reaction that is, we may see the reaction of the cells. As for the lipoproteins, they won't do harm, and they do not damage the cells, because the main function of the lipoproteins is a logistic. They transport the cholesterol and the lipids to the new cells that are formed at the place of all the cells at the they who are dead already. We speak about the low density proteins. As for the high density lipoproteins, they also could act as logistic proteins, but they also remove the wastes from the cells, and they transport it to the liver. As for the exchange of old cells to the new cells, there is also an exchange in our body. We spoke about the low density proteins, and as for the high density proteins, their possibilities are not very high, because the main sanitars and main structures that could remove the cholesterol and other harm things from harm matters from the body. These are the macrophage that could transport the matter from the cell to the blood, and then they could remove it from the body. But the energy of macrophage may be not sufficient to remove. They could capture, and then their work is stopped. In this case, we speak about hypoxia and the accumulation of macrophages and wastes that can form the conglomerate. It is the plaque of atherosclerosis. Uh, these studies made a special term about the process of macrophages to make it a reverse process in order not only to form the atherosclerosis plaque, but to reduce its size. We speak in this way about the improvement of the blood coagulation and the feeding of the cell uh, and also providing the oxygen. And going back to we speak about the improvement of blood coagulation and the feeding of cells and providing the additional oxygen. And in our ozone therapy, we use the additional oxygen without passing the lungs. We could make this process. As a result, we could consider the ozone therapy as the efficient way of treatment and the preventive method of atherosclerosis. Thank you for your attention. The question is about the oxygen of the concentrator. Should we use it in the same way as the cylinder oxygen? Uh, it depends on the dosage of the oxygen from the concentrator because you have to consider the concentration at the output. If the dosage of oxygen is lower than 92%, it is household oxygen. It contains many impurities, so it couldn't be compared with the medical oxygen that we have in cylinders. They have been discussing for a long time about the application of oxygen. Which oxygen should we use from the concentrator or from the cylinder? I would like to know that the concentration of the concentrator is also powerful because it contains from 95 up to 97% of oxygen, and it is nearly the same figure. Uh, I'd like to mention that the application of ozone therapy in concentrators doesn't have any problems. As for the cylinders, you must use the special premises located in a separate building, so it won't be comfortable for you. And the ozone concentrator is rather common and comfortable to use. The question is, could you recommend a powerful concentrator that you use in your own practice? The answer. Nowadays, nearly all the companies that produce the concentrators are efficient. We speak about USA, Germany, China that provide a wide range of concentrators with power from 1 liter up to 12 liters per minute. The names of companies are Armed and Foley. The question is about the application of ozone in the case of a chronic pelvic pain. Yes, for sure, we could use it in the method of rectal insufflations because the oxygen is provided to the veins, then it is absorbed and it is transported to the organs of a small pelvic. So there is an anti-inflammatory effect. Dear colleagues, thank you all for the meeting. I wish you a strong health and I wish you the success in the ozone therapy and in your personal life.